A non-governmental organization, Save the Children International, has expressed concern over the worsening state of multidimensional poverty in Nigeria, exacerbated by the pandemic, inflation, and global shocks. Despite showing the positive impact of social protection programs, the funding remains insufficient, the coverage limited, and multi-overlapping crises are pushing more Nigerians into poverty. The country director of the organization made this known in Abuja during the closure of the third phase of the expanding Social Protection for Inclusive Development program, which was jointly implemented by the Save the Children International and Action Against Hunger across the northern states of Jigawa, Zamfara, Kaduna, and Kano states. He therefore stressed the urgent need for robust social protection in Nigeria, pointing out that the country continues to face escalating poverty levels.
Through this investment from the UK government, they have provided £4.7 million over the last 3 years to enable us to implement this programme. And again, we thank them for their generous support through the last 11 years of this social protection programming. Nigeria needs social protection programming very badly. The demand is very strong. The nation continues to grapple with rising poverty. According to the National Bureau of Statistics, 63% of those living in Nigeria are multidimensionally poor, and 65% of these live in the north of the country. 2/3 of these are children are multidimensionally poor, while half of all poor people are children. So these are shocking figures for a country so richly endowed with human and natural resources. And as Save the Children, again, we really have wanted through this program to ensure that children are supported and are the main focus of the social protection programming that is put into place. Over more than a decade, therefore, we've remained committed to advancing social protection with a particular focus on children. Children, as you know, are among the most vulnerable to malnutrition and poverty, and they are our nation's future.
15% of the population at the moment face critical food and nutrition insecurity in 2024. It's been getting worse, with an additional 8 million people into poverty this year. Nigeria has the total number of food insecure people in the world, in terms of total number in the world. The UK has backed the 800 million World Bank loan for social protection at the World Bank Board, including the rollout of temporary social safety nets to some 15 million households. The World Bank's quick dispersing support for livelihoods is also planned. However, we all know that this is stuck, and we really need technical solutions, and we need the political will to get cash out to those who need it most. I believe that ESPID has generated some very important lessons learned, and look forward. Nigeria is in urgent need of a functioning, shock-responsive federal and state social protection system. It needs to deliver a mix of both cash and food to an increased number of poor and vulnerable households, and it's got to be able to scale up in response to shock. The UK will continue to focus on supporting the government to tackle the current food security crisis, while helping to lay the foundation for a functional, shock-responsive social protection system. Some of the early outputs and actions that we need to look out for is we absolutely need to drive internal and external coordination. There needs to be more coordination amongst the sector on social protection. We need to build the evidence base on impact. What is working, what works, what doesn't work.
Over the past few years, we have made significant strides in system strengthening, capacity building, and advocacy for the institutionalization of social protection. Through targeted interventions, we have worked diligently to enhance the capacity of local institutions, empowering them to better serve their communities. We have engaged with government stakeholders to advocate for policies that prioritize the most vulnerable, ensuring that social protection is not merely an afterthought, but a fundamental component of development strategies. The learning we have garnered through this project has been invaluable. We have documented successes and challenges alike, which will serve as a roadmap for future initiatives. Our commitment to learning will guide us as we continue to adapt and innovate in our approach to social protection.